Hi, welcome to Facebook Live. I'm Dr. Annette Mercatante from the St. Clair County Health Department, and I'm here to answer your questions, your COVID questions, I guess any questions. And we'll start out this week with this week's update on our epidemiology, our rates. So the top blue bubbles are our totals. These are totals from March of 2020. At some point, we're going to have to break these down into annual totals, Mr. Fay, but one of these days. But this is still how it's being presented statewide and nationally as well. So as long as we do this, we'll be consistent with surveillance tools as well. So, anyways, our total cases close to 27,000. Over 900 hospitalized, over 500 deaths. And on the bottom, green bubbles are the past week's changes, which you can see in the past week. We've had, is this 1,000 cases in the past week? Okay. First time I've been looking at this. That's a lot of cases. About 150 average new cases per day. And I'll emphasize these are the known cases. These are the cases that get into the MDSS system because of positive PCR antigen testing that's submitted. So home tests, et cetera, are not included. Also, we have 8 new COVID deaths and a rising percent positivity testing rate of 23%, which exceeds the state's overall testing positivity at this time. So here's our epi curve. You can see this unusual curve, especially compared to our last 2 peaks, which went up and then came down. This one has kind of gradually increased, plateaued at a high level, and now is increasing again. It looks like we've plateaued there, but I don't think so. I think that's just the variability of as the data comes in over holiday weekends, et cetera. That data can get skewed on a day-to-day basis, but the overall, I think, will be more compelling. Next slide. And, oh, hard to see. Sorry about that. This is our vaccination data. You can see that the lion's share of vaccines remain the booster shots, although we are getting first doses in there. And our most unvaccinated population remains our younger population. And we still remain below the state average for vaccination rates. And I threw. Oh. Elise?
Yep, it looks like a dock is frozen.
Sorry about that. Okay. I think I'm back.
Okay. All right.
Let's get back up there. This is our a slide that came out of the state's data modeling surveillance data that is also available for the public to see. In this situation, there's several slides that have been tracking cases and trying to compare testing policies with cases. And as you can see here, it is very compelling information to suggest that schools that have masking rules, either partial or complete, are seeing reductions in cases. This is also bearing out nationally in some other national studies, although absolutely not a panacea, a one fit like you do this and there won't be any problems. It clearly correlates. Every mitigation strategy put in place correlates with a lower amount of case rate. So I just wanted to throw that out there because as we go into these really high transmission weeks ahead of us, we need to look at ways of keeping our schools open, keeping our businesses open, and keeping our lives moving functionality wise. So those masks, people are still a very valid choice. Next slide. Our data dashboard that gives our totals to date. Total hospitalizations are totals to date, not our current hospitalizations. Our current hospitalizations are about, I believe, 20% of our total hospitalizations. So we're up there, but we're talking about dozens, not hundreds. Next slide. Did we throw that in there? Yeah. Okay. So a lot of questions about vaccination rates, how much breakthrough vaccination rates we're getting. It's always difficult from our local data because we're a smaller county, and when you start looking at local data, it can easily be skewed by reporting glitches, etc. But statewide and nationally, we continue to get very consistent, reassuring information, and most importantly, the vaccine prevents serious illness. And in this slide that was released today by the Michigan Department of Health and Human Services shows that 87% of our current ICU COVID patients are unvaccinated. Still, a very significant portion of total hospitalizations are unvaccinated, of COVID vaccinations are unvaccinated as well. And it remains the truth that vaccinated individuals are getting reinfected or infected at a much lower rate. So even though vaccines aren't again a guarantee, they are still your best bet of remaining out of the hospital. Okay, so Jen,
Okay.
I don't have a piece of paper in front of me this time, so
Oh, okay.
sorry,
So
don't
no
have a
problem.
sheet, so
No.
you just tell me what you want to
Sure.
talk about.
All right. So we were going to ask you in your talking points today to talk about the mitigation measures that people need to continue those and just to go over,
Sure.
review
So we,
those.
so we talked about masks, and by the way, if you are in a particularly high risk situation or you are a particularly high risk individual, it would be not imprudent to use either a double masking system or an N95. So the better the mask, the better it works. Of course, it doesn't work at all if you don't use it. So you need to consider these the masking options when you're in crowded situations and indoors. Physical distancing is very important. The argument rages, is this droplet or aerosol? Regardless, the virus is spread from person to person through respiratory secretions. So the further you are away from the person, the lower that viral load will be. Um, Hand washing, very important. Cleaning of frequently touched objects, surfaces, just trying to get rid of that virus wherever it may have landed. I've noticed that there seems to be kind of people aren't putting out that hand sanitizer the way they used to. It used to be everywhere, and now I go to use the hand sanitizer and it's kind of empty. So let's get that hand sanitizer out and use it as much as possible. Probably this one of the most important things to remember is if you are sick, to identify whether you're sick from COVID or not. A test will do it. If you're still not sure, do another test. But there is the need for people who have COVID to isolate, and those that have been exposed to those individuals to quarantine. And this is a thing that everybody's going to have to do on a personal level. It is when we have rates this high, there is no way you're going to get a call from either us or the state, other than to tell you you have in fact been identified as a case, or you have in fact maybe have been identified as an exposure. What to do with that information is it's your baby. You got to do it. So we want people to remember that, especially around the holidays. So if you're sick, go get a test. And if it's positive, please don't go to a Christmas party. Please don't have people over your house. Just kind of do your isolation thing. It's 10 days. It's 10 days regardless if you're vaccinated or unvaccinated. If you're positive, you're positive. And we want you to wait the full 10 days before you go out and about again.
And
Did I miss anything? No, I think that was it.
I don't know if you mentioned this off the top, but also get vaccinated and get your booster if you're eligible for your
Oh,
booster.
that goes without saying. I'm sorry.
Yep.
Thank
No
you.
problem.
That goes without saying. And I would say get your booster. So if you're fully vaccinated, I think boosters are wise. And if you've been holding off, now's the time, people.
So our other talking point was about the booster, who the CDC recommends it for right now, and
Mhm.
how you go about getting that, the
Yeah,
time
so
process.
things are getting kind of squirrely, and I think it's time that everyone over the age of 18 gets boosted. All right. So if you've had an mRNA vaccine, you need to wait 6 months from your primary series, or 2 months from your J&J series for your J&J vaccine, and that would be regardless of risk status. Whether or not have an underlying health condition or et cetera, it's opened up to all individuals over the age of 18, which I've been saying all along, but now it's official. So come get your booster.
And our last talking point before the questions was about just a data reminder.
Oh, yeah. Well, I've been saying this all along too, right? We strive, and I want to say that we work really, really hard to make sure that what we put out is as close to accurate and as valid as we can possibly make it. But data collection in real time during a pandemic is challenging. It is challenging, and you cannot consider the day-to-day numbers as being numbers that specifically um, tell you exactly how many people have had this or that. They're great estimates. They're great ways of following things as a surveillance tool to identify whether we're getting into more trouble or less trouble. But like everything else, um, this final data piece, it will be years before we get final numbers that have been weighted and washed out and verified. So when you look at our data, consider it a real time assessment of what's going on. It is in our best efforts and our best way of doing this. And we're not changing numbers, malingering. We're not purposely inflating anything. We're just putting it out there as we know it. But they're they're real time, and so you have to understand. And when you have data points coming in from hundreds of different locations, there's always going to be adjustments, and that's why when people say, "Well, you said this last time, and now the number's this," that's because these numbers are meant to reflect averages or changes or trends, not the absolute number of things that are happening.
Yeah, so sometimes there are going to be delays and limitations.
There's a lot of delays and limitations. So
Right.
weekends, our numbers are skewed. Holidays, I guarantee you, our numbers will be off because people don't report numbers. The state's not working on the weekends, people, and holidays. So when these numbers go in, it takes a while for everything to catch up. So you just need to remember that and understand the reality of what we are doing. Okay, it's not the ideal; it's the reality.
Okay,
Okay.
so I'm going to get to two questions that we had come through beforehand, and then we'll get to the live because I see there's several questions already
Okay.
there.
Good.
Okay,
Good.
so the one that came through the email was, if St. Clair County is committed to COVID-19 community immunity, then why are those with natural immunity being discounted and discriminated against? We know any antibodies are still found 8 months after infection, and that beyond that, memory T cells begin producing antibodies immediately upon re-exposure. The incredibly low, almost non-existent rate of reinfection supports lifelong immunity. Furthermore, vaccines are meant to mimic natural immunity by kickstarting an immune response. So I ask again, why are those whose immune systems have responded to natural exposure being discounted and discriminated against?
Wow, that's a loaded question. All right, let's start with being discounted and discriminated against, because I really don't understand what that means. Unless it means whether or not you are going to be required to vaccinate or whether or not you are being asked to quarantine. Um, but those policies are based on what we know, and our best estimate of who is at greater risk, and et cetera. So I wouldn't call it discrimination. Certainly not in the legal sense, and certainly not, I don't think, in a moral sense. So uh, maybe you can, and we're certainly not discounting anybody. We're just kind of applying best practice to individuals as we go to try and reduce community spread. So we know, this is your comment, we know any antibodies are still found 8 months after infection. We don't know that. I don't know where you're getting your information from. certainly the experts I talk to and the papers we review, there is certainly no standard knowledge of this being a known fact. It's way too early in this virus history and the pandemic to say that. We do know that after 6 to 8 months, a lot of people still have antibodies, but what level of antibodies is protective? What type of antibodies are protective? Is it antibodies against spike protein or antibodies against the nucleoprotein? There's just a lot we don't know. And so to say that we know this as a fact that 8 months later after a natural infection, you're still protected is just not true. Okay. I don't know it. So if you know it, great. Good for you. But certainly the people I rely on to guide me through this horrendous pandemic are not saying that. So the other question is, um, the incredibly low, almost non-existent rate of reinfection. That is also not true. So there was some recent studies came out of, I believe this country, the CDC has posted that post natural infection versus post vaccine infection, um, there's almost a 2 times greater rate of reinfection among those who are naturally infected than those who are vaccinated. So, although it's much less, it's not non existent. And certainly, natural infection is not providing the same level of protection that vaccinations are. Now, we do have solid evidence of that. So, you put all this together, a lot of the unknowns, the fact that we know that natural immunity absolutely wanes, and it seems to wane in a way that we can't, like with at least with the vaccine, we can boost it up, right? We can get a booster shot, we can boost it up. We can't do that with a natural infection immunity waning. Um, and I had a point there, and I almost lost it. We also know that we're giving the policy of 90 days after infection, having the same level of protection as a vaccine. Maybe 90 days is a little short. Maybe we'll go to 6 months in the future. But again, that level of information and certainty does not exist in the scientific world as I know it, and as the virologists and immunologists and the experts that study this know it. So time will tell. Maybe we'll expand that natural immunity window as a protective factor, but right now we're just kind of trying to provide the best guidance we can for the greatest amount of people. So if you've had a natural infection in the last 90 days, consider yourself the same level of protection as vaccines. However, obviously there's a lot of gray areas there. For instance, we know that people who have asymptomatic infections might mount a weaker immune response. Might. Okay. So does that mean if you just had a positive test 6 months ago, you're still protected, but you hardly had any symptoms at all? Maybe not. Maybe not. So there's just a lot more we need to know. And I think the policies right now are made to try and take into those considerations of uncertainty and try and create a safety zone that we can all be comfortable with. I hope I explained that well enough. But I'll just go back to say I don't believe we're discriminating against it. We want everybody to survive this stupid pandemic, right? We want everybody to be well. Just not the unvaccinated or the vaccinated. So let's work on this together. We appreciate that.
Okay, and another question that came through was my employer is mandating the vaccine, but I received the antibody treatment and will still be within my 90 days by the due date. Can I delay my vaccination, or can my employer fire me if I don't meet their deadline? So
So
they had COVID, got the antibody treatment. I'm just wondering about
any
that.
vaccine mandate has to allow for valid medical exemptions. We know that not everybody can get vaccinated, right? Period. We know that. There are always individuals for lots of reasons who can't be vaccinated safely. So, to answer your question, I do not believe your employer could terminate you for a delay in your vaccine. You do need to wait 90 days after a monoclonal antibody treatment, right? 90 days. Okay. In most situations. Um, So your vaccination date needs to be delayed until it's due. Okay. Otherwise, the concern is your vaccine may not be as effective, right? The monoclonal antibodies may interfere with your immune response. So you need somebody to write that down for you. So if there's a medical exemption form that your employer has, you just need to kind of sign that off. Maybe your physician can help you, confirm the fact that COVID vaccines need to be delayed after COVID monoclonal antibody therapy for 90 days.
Okay, we're going to move to the live questions now. This one is from Kelly. She asked, if someone is vaccinated and they come to work with symptoms, should I be wearing a mask?
Well, let's back it up. I think everybody should be wearing a mask right now. Okay, everybody. When you're out and about, outside of your home, outside of your pod, or maybe outside, away from lots of people outdoors, we should be wearing masks. So yes, you should wear a mask. If your coworker comes to work ill, vaccinated or unvaccinated, they should be tested to see if they have COVID. Okay. And if they have COVID, they shouldn't be at work. Actually, if they're ill, they shouldn't be at work, because what are we waiting for? We're waiting for our next influenza season to jump on top of it. We've just gotten through a bad RSV season. We have lots of viruses. We don't want any of these viruses to spread, right? Because every level of infection is an added burden to our healthcare system. And we're back to where we were in March of 2020, when we were so worried about our healthcare systems being overwhelmed. We need to keep our systems working, which means people need to take care of themselves and not spread their germs. Okay. So don't spread your germs. If you're sick, don't go to work. And even better, make sure it's not COVID, so that you know how long you need to stay off. Because if it's not COVID, you need to stay away from other people until your symptoms are resolved, right? We say 24 hours after all of your symptoms are resolved, then you can go back to your activities. So that's not necessarily the same as COVID, where we're asking you to stay away for 10 days using a temporal guidance for that, and not just your symptoms.
Okay, the next question is from Kathy. She asked, I keep hearing from people that the vaccine will cause women to become sterile, and one person put her mask on when she was near me because she did not want me to shed my vaccine on her.
Well, that's unfortunate that people are still sharing such bad misinformation. There is absolutely nothing theoretical or real about the vaccine impacting fertility. That was a rumor that was started. It's so sad. Talk to your obstetricians. Talk to your diet. It's not true. Okay. Well, all I can say, it's not true. So, number one, that's unfortunate that people are living in fear like that. There's enough to be afraid of. You don't need to be afraid of the stuff you don't have to be afraid of. Vaccines do not shed virus. Vaccines have no virus. The vaccines we're currently using have no virus in them. There's no way they can make you sick from COVID, and there's no way they can make other people sick from COVID. So they're probably confusing vaccines when we used to use live attenuated virus for some of our vaccines that did sometimes shed. That is not the case with COVID vaccine. So unfortunately, she's just misinformed, and I would encourage her to go to our website, where we have a lot of that information. We still have vaccine commonly asked questions, right? I think
Yep,
we do. Adding them all the time. Yeah.
yep. Okay, the next question is from Nikki. She asked, when would you recommend that schools go virtual?
The schools are going to go virtual when they don't have enough teachers and staff or students to stay in person. All right, that's the reality. We want kids to stay in school, and we want these kids to have the benefit of in person learning, because this pandemic is not going to just go away. So we need to function in the best interest of our kids. Now, in my opinion, the school should be adding significant layers of mitigation. All the things I talked about 10 minutes ago, our school should be layering on when we surge like this. Okay, it doesn't have to be forever, but while we're surging, we should be adding layers, we should be adding masks, we should be adding physical distancing, we should be making our class sizes smaller. We should be doing all of that, because doing that will reduce transmission and will improve the it will improve the likelihood that we don't have to go virtual. We don't want to go virtual. We're going to be forced to go virtual because there's so much infection happening. So, what we want to do is do the things ahead of time that prevent us from going virtual. If that, that's so. Remember at the beginning of the pandemic, the response was shut down, shut down, shut down. And let's face it, when we all shut down, it does work, right? The virus needs person to person transmission to, to keep moving through our community. Um, but we're almost 2 years into this, and it's pretty obvious we can't afford to shut down. I mean, if we shut down now, it's because things are going to be really, really bad, and we're going to have to shut down. Okay, so what we want to do now is all the things we can do that we know work that will reduce transmission, so we don't have to shut down. And that's where our urgency and our pleading is right now. It's not too late. It's not too late. You saw that curve. That curve could go in the way wrong direction. It could get a lot worse, and we can hold it here. We can hold it here if we did all the right things. So that's my plea, to not just schools but businesses, all of you guys out there listening, is let's do these things we know can slow transmission, and let's keep this curve down so we can all keep doing stuff. Okay,
Okay.
am I frozen?
Sorry.
No.
Nope,
Okay.
you're not. I got kicked off of my thing and I'm trying to get back on it again. So I apologize if my questions are out of order now. This is from Kim. If you have had both of your Pfizer vaccines, but you haven't had your booster yet and have come in contact with someone with COVID symptoms over 2 weeks ago and you haven't had any symptoms, will the rapid tests you get from the store show you are positive? Because of your vaccines, my son did
No.
quarantine himself for 16 days with no symptoms.
Okay, let's go through that a little bit. Can you keep that question up for me so I can go through it? And thanks, Kim, because I think what you're describing is a lot of things. So first of all, I think you bring up an interesting thing. So people who have been fully vaccinated and not yet had their boosters, our advice to quarantine hasn't changed for them, I don't believe. So, I mean, if you get we want everyone to get their booster because we believe that will improve their immunity against this next onslaught of virus. But if you're fully vaccinated, we still advise fully vaccinated people that have been exposed to a positive individual to monitor themselves closely, which means monitor yourself from symptoms, and if possible, test yourself on days 3, 5, and maybe even 7, wearing a mask when you're ever outside. So just being extra careful in case you do have a breakthrough infection after that exposure, that you don't inadvertently expose other people. If you're unvaccinated, you have a much greater risk of actually getting infected after exposure. And we are asking you to do that quarantine piece by staying away from people for that full 7 or 10 days, 7 days if you test, 10 days without a test. So that's still the discrepancy about vaccine versus non-vaccine. Now let's go back to if COVID symptoms, somebody had COVID symptoms over 2 weeks ago. Exposure to an individual with COVID starts at the last date you were exposed to them, and technically it's a full 14 days. We know that after 14 days, virtually no one who is infected will continue to break through. So, if it was over 2 weeks ago, over 14 days ago, where that last exposure is, there really isn't any further concern if you're asymptomatic and you've tested negative. By the way, it's always nice to test, in my opinion, because we know we have a lot of people who are very mildly infected, or asymptomatic. So it's always nice to do that test somewhere in there. Um, Will the rapid test you get from the store help? Yes, yes, it will. Now, the rapid tests are sometimes falsely negative, especially when you're asymptomatic, but it sure beats doing nothing. So if you've been exposed, it's been a week, maybe longer, you do a quick rapid test, it's negative, you're good to go, I think. Just be careful, right? I'm asking everyone to wear a mask anyways. If you know grandma's got if grandma's got lymphoma, Just be careful around her. I mean, I just think there's things that you have to do all the time because this virus is everywhere. So you know you had an exposure 2 weeks ago, but you don't know that you didn't have exposure 2 days ago. Let's face it. There's so much out there. You could have very easily had an exposure more recently and not known it. So everybody's got to walk around and function in this understanding that they could very well be incubating this virus. All right. That would help all of us if everybody acted that way. So you do the test and it's positive, and it's positive. You won't be positive from the vaccine. The vaccine cannot make you test positive. There is no vaccine induced false positive possibility here. So if you're positive from a test, it is because more than likely you have the virus in you. Okay. There are rare situations of false positives, but I would say it's much more likely if the test is wrong, is it'll say negative when you're really positive. So let's just say that. So my son quarantined himself for 16 days. Good for him. He really only needed to do 10 or 14 days. But, you know, now let's talk about if you have somebody positive in your household. So you got exposed 2 weeks ago, and then someone else in your household ended up getting sick because of that. Everybody in your household, their quarantine dates need to start from the last day that you were infectious. And remember, the infectious period is considered 10 days. 10 days. So in a household, everybody's quarantine period kind of starts at the end of that 10-day isolation period, not from the onset when things first started to happen. And that's a common misunderstanding. It can really extend things. We know that. And that's where a lot of this flexibility in quarantine comes in, and where we start talking about variables to try and get people, keep them functioning, keep them working. So I don't know. I hope I there's a lot in that question, but I hope I was clear with that.
Okay, Doc, I just have to talk to Elise for a minute. I got kicked off, and so some of the questions before Kim's got cut off. So Elise is going to put them up on the screen for me to
Okay.
read to you. Okay, this
Okay.
one is from Kelly. If I was off and positive and my husband came down with it for days after, should I be quarantined longer if I've been exposed to him?
Oh, great. Kelly, thank you. That's exactly the point I was trying to make at the end of my last statement. So your quarantine period, the period where you are going to self monitor yourself and make sure you don't expose other people to the virus in case you have it and aren't showing symptoms yet, that quarantine period has to start on the last day your husband was infectious. Okay. So your husband is infectious, technically 10 days from the onset of his symptoms, or 10 if he doesn't have symptoms, 10 day from the day he was tested positive. And then your quarantine period, assuming you're living with them, right? I mean, I'm not going to get into your personal life, but assuming you're living in the same household with him, sharing the bathroom, whatever, then your quarantine period actually has to start at the end of his 10-day isolation period, which really extends things. Now, if you want to go live in the basement and separate yourself completely, then you can go from the last day, you actually had exposure to them. And some people are doing that. But a lot of people don't have that option. When somebody in the household gets sick, they're all there together. And so it really does extend the time that you have to be really careful.
Okay, thank you. Doc, it's also 4:03, so we'll go till 4:15 if we can get through all these questions.
Okay.
Okay, Elise, can you put the next one up, please? Okay, from Mary, have you seen people who are 2 weeks post-booster getting
I don't
COVID?
think so. I don't know. I haven't seen any yet. I can't say, have you seen any yet? I don't think we've seen any post boosters after that 2 weeks. We certainly have seen people who get a booster and a few days later have COVID, right? Which we just assume they didn't get that booster in time. But right now, fingers crossed, we still think that vaccine with the booster is your best way of avoiding infection, and certainly your best way of avoiding serious infection.
Okay,
I'm
Elise,
not
can you put
saying
the
it's not
next
going
one
to
up?
happen, but I don't think we've seen it yet. Go ahead.
This is from Georgia. When do the 10 days begin after a positive test? From the test date?
From the test date, if you're not having any symptoms. But say you woke up on one day, and you had you lost your taste and smell, and you had a little tickle in your throat. You could feel yourself feeling a little sick. You had low grade fever, and then 2 days later you got the test and it was positive. Your 10 days begins on the day you woke up sick. Okay? So you get that 10 day, you get to go from the day you know you got sick. And that's one of the things we used to do with people is kind of talk to them like what day. And if you know what day you got sick, your 10 days starts from there. A lot of people, though, don't really have a lot of symptoms. They don't really feel sick. And then their 10 days has to start from the day their positive test came in. But if you're sick and it's just taking you a couple days to get that test, you can use the onset date of your symptoms as day one.
Okay, Elise, next one. Cassandra, does exposure to COVID post-infection or vaccination strengthen your existing immunity?
I don't know if exposure does, but infection would. Okay. Every time your body fights a COVID virus, it's going to boost up its immune system. So if you had an exposure, we do think reinfections tend to be maybe a little less severe. There is some evidence to suggest that. It's not a guarantee, but those kinds of reinfections do seem to boost the immune system as well. If it's just a simple exposure, and honestly that virus isn't entered into your body and started replicating, it's not going to do anything to your immune system. Your immune system gets boosted when that virus is replicating inside of your body. And
Okay,
remember, not everybody who's exposed necessarily has been infected. So that's kind of the game that we have to keep playing with all this information.
okay. Elise, I think I see the question before Kim's was from Jonathan. So what do the CDC survival rates say?
I still believe it's a little over. I just did the math. I think it was 1.6% for fatality rate. Since May, 118 people have died from COVID. Out of how many, though? He's asking for survival rates. Yeah. But in general, the mortality rate of people who've died with known infection has really not changed too much. It's between 1 and 2% that actually die from cases we're aware of. So there's all kinds of variables there. So it's not just death we worry about. So it's the long COVID appears to be much more serious than we originally thought. People stay sick for long periods of time and feel crummy for long periods of time. I don't need to talk about missed work and people who can't function. And then when you think about people who survive but have spent 2-3 months in the hospital with a trach and the problems that they have with that, post COVID sequelae include renal failure and just a whole range of really serious chronic problems that do persist many times after a person recovers from the acute viral infection. So there's a lot there in that surveillance piece that is going to get fleshed out over time. I think mortality rates are going to be one factor we're going to be looking at, but you got to remember that all cause mortality rates seem to be increasing as well. So not just people dying from COVID, but from people dying from all other causes are also increasing, which is very alarming. And that shows you the stress that this pandemic is having on our system in general. So more to come on that.
All right, the next question is from Donna. She asked, are there different symptoms with the new variant? And is all testing checking for variants also? We haven't talked about the new variant today.
The new variant, we haven't talked about the new variant. So Omicron. Omicron. Am I saying that right? I'm terrible at words. Is that how you say it? Omicron. All right. So now we know Omicron is if it's here, it'll be here. We are doing surveillance. It's not on all samples. We send samples from outbreaks, people who've traveled, any kind of situation where it looks like there's a super spreader event. We're sending samples for genetic sequencing of those. So it's a sampling. What I heard, I think they hope to sample 10% of the testing. So it won't be everybody, but it'll be enough to pick up on it. So we will find it. As far as what we know about Omicron is not a lot. So first of all, don't jump to conclusions. There's a lot we don't understand. In South Africa, where they first detected it, it appears to be spreading very, very rapidly. But of note is they didn't have a real high Delta surge there either, the way we do here and in Europe. So there is a little caveat there that maybe we can't compare apples to apples, but it does seem to be more transmissible. It has the genetic variations that have made some scientists and virologists believe that it could escape some of the immune responses that were previously developed from previous illness and from previous vaccines, i.e., we might see more breakthrough reinfection rates, but that has not been shown clinically or in the laboratory yet. So I would say at this point, and certainly we don't know anything about clinical symptoms, whether it's different. That's right off the table. I haven't seen anything about that. So more to come. All I can say is that we're on it. We're watching it closely, and when we know, we'll tell you. You'll know. We're going to plan for the worst, but we're going to hope for the best, because this may not be nearly as bad as everybody is worried about.
Another question from Jonathan. If you wear a mask, how will you ever get to herd immunity?
If you wear a mask, how you ever get to herd immunity? Well, number one, let's go. So wearing a mask, no one says that that's going to prevent you from getting infected. It's going to reduce the rate of infection. So from a personal level, it helps, but it's way more effective at a population level. So if we have an entire community wear masks, we may go from, I'm just going to use a number, maybe 200 infections to maybe 100 infections. It might reduce that transmission by half, which is pretty darn significant when we're talking about what we're talking about right now. So mask wearing is an epidemiologic, it's a tool to reduce the rate of transmission. If you get infected, regardless of mask or not, you're still going to have the same kind of immune response that you would normally have. And then the other question was herd immunity, which was a big talking point. And I think the real question is if we're ever going to get to herd immunity. And I don't think it's based on how many people get infected. I think right now the biggest concern is, as we have these millions and millions of virus replications every day, if these genetic mutations will ever allow us to get to a herd immunity level. And there's a lot of discussion about that and what that level is going to have to look like. Does it mean that 90% plus of our population has to have immunity to that particular variant? It'd be kind of hard. It's going to be kind of hard to do that. The other thing you have to remember is that if you're allowing herd immunity to occur, if we just throw our hands up and say, what the heck, let's all get infected at the same time and let's get this over with, we will have an unacceptable level of death and suffering as a result of that, which I think most normal communities and populations would like to avoid that if possible. So natural infection, although very effective in reaching things like that, can be devastating to a population. And that is kind of our goal, is to get through this as a society still relatively functional.
Okay. Mary wonders, when you were talking about schools doing the layering, such as mask, why are you leaving the decision to districts versus doing a county mandate?
Mandating. All right, I'll be really frank. So mandates are ignored by a large portion of the population, and quite honestly, there's no enforceable method. We can't have the mass police come in and force masks on people. If there was compliance, and we felt that mandates would allow for compliance, then it would make some sense. But as you notice, statewide, no one's going in this direction. It's because the goal is compliance. The goal is to get people to do what it needs to be done to reduce the transmission of the virus. The goal is not to make people do stuff, right? So we think a better way of urging people into a compliant mode and to do the things we know can be helpful, is to allow them to make those choices with good information and solid support. And I think that's where we're trying to go with our schools. There is no reason you or your kid shouldn't be putting a mask on. I don't care if the school says you have to or not. If everybody put their masks on their kids, and let's face it, I'm a grandma. I talk to a little kid. They don't love it, but if you say, "Look, you have to do this so that you don't bring virus home to mommy and daddy," they're okay. Most of the kids are okay with it. They just need the support from you and from the community that they need. So I don't know. Throw that question back up there real quick for me. I want to make sure I'm kind of understanding it. So the question is, why aren't we mandating it? Because we don't think mandates will work at this point. Quite honestly, you remember if you guys all remember back in September the hellacious uproar of all this stuff. So we're gonna just work with everyone and try and get them to do what they need to do and get you guys to do what you need to do, and we'll just like muddle our way through this.
Okay. It's 4:15, and I'll just read a couple more questions, and then we'll ask people
Yeah,
to.
let's try and answer as many as we can, Jen. Things are kind of
Okay.
a bit out
Okay.
there, and I do want to make sure that we respond.
Okay. Sounds good. All right. The next one is from Tracy. Are the home COVID tests accurate enough?
They're okay. They're better than nothing. Okay. They're actually pretty good. The problem is there's hundreds and hundreds and hundreds of them, and I can't really tell you which one. I'm sure we're going to see batches of some of these home tests that get recalled because they realize that some reagent wasn't stored properly. I'm sure that's going to happen. But for now, all I'd say is that they've made it onto the shelves of your CVS or what, right? That they've probably gone through some EAU process, right? They've been kind of uh, approved, and they do work fairly well. They work exactly the same way like home pregnancy tests do. And just like a home pregnancy test, if you do one and you're not sure, you have it verified, or you have another test done that can secure that diagnosis correctly. And that's what we want you to do with home tests. If you're really not sure and it's a really important thing for you to know, go get a PCR test.
Okay. The next question was from Nikki, and you kind of talked about this a few minutes ago, but she wanted to ask if you could tell us about the variant Omicron.
Yeah,
Omicron.
so it just this kind of what you guys know. It's out there. Now that we're looking for it, we're gonna find it. I'm sure it's inevitable. What it will do is what we don't know. Okay, so whether it will become another surge or whether it'll just kind of blend into kind of a low level infectious rate at some kind of plateau, whether it'll be more severe, whether it'll cause more reinfection rates, all those things, I don't think anybody can tell you right now. It's too early to know.
Okay. This one's from Kelly. If I was positive and my husband came down with COVID, do I need to quarantine longer? I think you already covered this one.
No, it depends on when you were positive. So if you were sick
Okay.
more than 90 days ago, I would just kind of do your normal 10-day quarantine. Um, and just like you would normally, just to make sure that you didn't get it from him. If you were sick a year ago, I would consider yourself vulnerable. And I'm assuming you're not vaccinated, right? But if you were sick longer than 90 days ago, there's a greater chance that your immunity may have tapered off, and we would just ask you again to just quarantine. But if you were sick like a month ago, then there's a good chance that your immunity is going to protect you that first 90 days.
The next question's from Dana, and you kind of covered this at the top of the hour, I believe. But do you have a count on breakthrough cases and how many have been admitted to the hospitals?
We have a count on breakthrough cases. I just saw that. Total. God. Okay. Brandon's looking that up right now. How many have been admitted to the hospital? That changes a lot. I think our last data point was about 22% of the total hospital census is COVID related. Um, 22%. I don't know how many beds we have, but it's a couple dozen people. So, it's significant, but it's not like the hospitals are filled with COVID patients. They're just filled. They're busy. And so that puts a strain on everybody. Um, and we'll get back to the breakthrough cases. Since September, 889 breakthrough cases. Out of how many? Out of 7,200. So that's a little higher actually than the state breakthrough rate, which is reporting 1.6% of a breakthrough rate. But we're watching that closely and see if that changes. Your risk for testing positive for COVID, four, 4 times higher if you're unvaccinated versus if you're vaccinated. 9 times the risk of death. That's state or our local data? State data. Okay. So if you're unvaccinated, you have a 4 times greater chance of being infected and a 9 times greater rate of being hospitalized. Oh, dying. Hospitalized is somewhere in the middle. Okay.
Okay.
Next.
Next, from Jason. I got a phone call from the health department last week saying I was a close contact over 3 weeks ago and recommended a quarantine. Was this phone call legit? They asked me to confirm what county I lived in.
Yeah, so our system is the contact tracing case investigation system falls apart as soon as we get into high levels of cases. So positive cases go into a system called MDSS, which is forwarded up to a state-run contact investigation called Traceforce. So that phone call. Oh wait, you were exposure, so that probably came from the PEG. We have a second automated system that we forward exposures to, and they generate those phone calls. I believe they're automated as well, although I think they were still trying to do some live ones. So yeah, no, it probably was legit. That's just how far that's just how far behind things are and how the system falls apart when you start throwing thousands and thousands of cases a day into a system like that. So this is why I'm going to say this really clear. Everybody has to do what they have to do. Do not wait for us to call you or the state to call you or any. If you have been tested positive, isolate for 10 days. If you have if you're a case, call the people who you've been with and tell them you have COVID and help them figure out what to do. And exposures, they're called quarantines. That's all on our website. I've gone through it again with you a few times. Those people who've exposed, they need to protect themselves and other people from inadvertently getting infected. It's up to you to tell who's been with you or not. So we want people to do this. We need people to do this because I'll tell you what, it's probably not going to happen from us or a state agency to notify you within a couple of days of your exposures. It might happen in the future when we're down to 20 cases a day again, but it ain't going to happen now when we're seeing 300 cases a day minimum. Okay, so I just want to be very clear about that. I hear that from a lot of people. I never heard from the health department. Forget it. Do what you have to do. It's called personal responsibility. We need everyone to be personally responsible for their illness and the people that may have been exposed to their illness.
Okay. Tiffany said, please encourage testing ASAP so that monoclonal treatment can be initiated and hopefully be effective when indicated. Inpatient admissions are placing large burdens on hospitals.
Thank you for bringing that up, Tiffany. You are right. There is a solid post-infection treatment called monoclonal antibodies that can reduce admissions to hospitals by as much as 70%. It needs to be given through an IV or through an injection process, but it's not a pill is my point. But we do have a system that's standing up now that should expand the ability for people to get this. You need a positive COVID test and you need a doctor's order. Now, it's not for everybody. It's for anyone over the age of 65, but if you're over 18 and have certain chronic illnesses, think about all the chronic illnesses that we know make COVID more severe: heart disease, lung disease, immunosuppression, cancers, any of those things. You should consider getting monoclonal, and the sooner you get it, the better. It's not effective after 10 days, and the closer you get it to that initial infection, the more effective it's going to be. So if you have COVID, call your doctor or call us, and we'll walk you through it and see if you're eligible for monoclonals and see if we can get you hooked up. But the first step is to get tested. You're absolutely right, Tiffany, and thank you for that. And by the way, every person who doesn't have to go to the hospital is saving another person's life, right? Some people are just going to the hospital to get tested, whatever. The hospital needs to be there now for people who need hospital life-saving treatment. So things like getting a test or getting monoclonals need to be addressed in other ways, and that's what we're trying to do. Don't go to the hospital to, I don't know. I want people to go to the hospital if they're sick. Please don't understand me. But we should be using our ERs for emergencies, not for routine things that your doctor can take care of.
Okay. And then Terry asked, if you have COVID, how long are you contagious?
10 days.
Okay.
Probably less. Quite honestly, Terry, probably less. But we know the vast majority of people after 10 days are no longer contagious. There are a few that are severely immunocompromised that can go beyond that. But that's why we say 10 days after you become symptomatic or after a positive test. Beyond that, you don't have to retest. Okay. Just assume that after 10 days, you're no longer contagious.
All right. And lastly, Dana has some follow-up questions about the data. So out of those 800 breakthrough cases, how many were hospitalized and how many have died? Same with unvaccinated cases.
18 breakthrough cases. Out of those, what did we say, 800 some breakthrough cases? 18 have died.
And do you know how many were hospitalized?
Well, no,
Okay.
I don't think that's a reliable. I mean, death is death. Hospitalizations are a little trickier to figure out. Go ahead. Same 3 months. 71 unvaccinated individuals have died.
Okay. And that was her other question. Out of the 6,000 cases of unvaccinated, how many have been hospitalized and how many have died?
Okay.
Okay.
Yeah,
And that,
hospitalizations are tricky because those aren't reported in a standard way, and so though we estimate the COVID occupancy based on some information, a lot of people go to other communities to get hospitalized. It's just it's not a real time data point that's a reliable indicator. So
all right. And that is it, Doc. We've had a couple people say thank you so much for everything that you're doing. They
thank you.
appreciate all, so we appreciate that. We'll be back next Thursday at 3:30. Normally we don't run this long, but since things are pretty heavy right now with COVID,
Sure.
we kept it to an hour today, but normally we try to do half hour. So
Keep those
we'll
questions coming in. We appreciate
oh,
them. Helps us understand what you need to know.
you can email us at COVID-19 at stclaircounty.org as well if you have any further questions. See you next week.